My name is Richard Dick Muth, and I have lived here in Huntington all my life. And I guess, as it was suggested a moment ago, I'm part of the legacy of St. Mary's Hospital and the Pallottine nuns. I've been involved with them for a number of years. I was on the St. Mary's board for 20 years before it became part of the Mountain Health System, and very proud of that, and enjoyed all the things that I was a part of. My grandfather was very instrumental in the founding of St. Mary's and in its beginnings. He was my grandfather was a fairly substantial member of the Catholic community in Huntington, and Huntington has a Catholic community. It's a pretty small group. So when the nuns came in, he felt it was important that he support them and try to encourage them and do whatever he could. The nuns would need help. They had gardens and they did their own laundry and landscape, whatever was done out there, they did. So he felt that he had 5 strong backs and weak minds who lived in his house. So that was part of his contribution to the Pallottines and St. Mary's in its early years. So those nuns were hard taskmasters. You know, he said they came over from the old country and they expected you to work. He was very interested in that hospital, you know, surviving and growing, because he thought that was it was a good instrument of Catholicism in Huntington as well as healthcare. I thought it was important that maybe I got involved with the hospital because my grandfather thought it was very important. I thought it was a good tradition to carry on in our family, so I kind of became part of it, and I enjoyed it and got a lot out of it, really. The nuns, they're everything, I think, in those days, but in those early days, they made that hospital. Their character, their charity, their giving, and they worked night and day. And you know, to leave your country of origin 5,000 miles away and come here and start something took a lot of courage. I mean, you'd have to give those people a lot of credit, and I certainly did. And for what little part I could do, I wanted to encourage that as well. I would like to see the traditions of St. Mary's carried on. The spirituality of what went on there, the charity of good women, and their hard work. I would like to see that legacy survive. There are many good people at that hospital today. I admire those people. I really do. I think they're a wonderful tribute to what those nuns started. I want to see that hospital prosper and survive, and I like to be a little bit of a part of it.